I'm checking the physician orders, and the physician has ordered a 16 French Foley catheter for Mr. Johnson, who's about to go have total hip replacement. Duration preoperatively to be DC'd postoperatively once the patient is able to get up and ambulate. Gather my supplies. Good morning, my name is Raine. I'm your student nurse. I have an order to place a Foley catheter for you before surgery to have your hip fixed. If you could please tell me your first and last name and your date of birth. And do you have any allergies? The patient has allergies to shellfish. So I'll be using the hydrogen peroxide rather than the iodine scrub for the placement. Explain the procedure to the patient. I'll be using a 16 French silicone catheter that will be placed in your urethra up to your bladder to make sure that your bladder stays drained during surgery and post-operatively. I would wash my hands and then prepare my area for my patient, expose them, but also provide a blanket for privacy and warmth. I'll be using the hydrogen, not iodine. So I put my prep on my cotton balls, put my gel here. Okay, and this hand's going to be my dirty hand. So I would penis came out. Lubricate and tell the patient to take a deep breath, and that I would be inserting the Foley catheter, and they might feel some pressure. And as I insert it, I start to see urine, and then go just a little bit farther, and then inflate. Once it's inflated, pull back. If I had an uncircumcised penis, I would have pulled back the foreskin and cleaned and then pulled the foreskin back down. In this case, this person's not. I would get out my specimen cup to take a sterile sample, and since this hand is dirty, I would put the urine sterilely into the specimen cup. I could, I'm using my clean hand, and then I would label with the patient's name and the date the specimen was taken. Take all my drapes off. Secure the Foley tubing to the patient's leg. Hang the Foley bag onto the non-moving part of patient bed. Make sure to give the patient back their covers. Give them their call light, put their bed in a safe position that they're comfortable in. I would wash my hands, and then I would document that the patient received a 16 French silicone catheter. Patient tolerated the procedure well. Sterile urine sample was taken and sent to the lab. The urine, we got 200 milliliters back. It was light yellow and clear, and because of the patient's iodine allergy, hydrogen peroxide cleansing fluid was used.